I'm Rob Murfin. I'm Director of Planning at Northumberland County Council, and my part in all this is about helping deliver places which can encourage active lifestyles. This has been an issue in terms of how active we are in society. That's been talked about for a surprisingly long period of time. The Garden City movement talked about designing places for people to live that had generous green open spaces, well-connected green spaces, biodiversity-rich public parks, high-quality gardens, tree-lined streets, and open spaces for healthy activity. And that was in 1898. The role of planning in activity is about giving the right landscape and infrastructure for people to make the right choices about activity, making it easier to make healthy choices and less easy to make those easy choices that sometimes perhaps we've all got into the habit of getting in the car for short journeys, stopping in the house all the time. So it's about designing and creating places that encourage activity where people can live, work and relax. That's the theory, but there are some problems about putting it into practice. I've been working in planning for a long time, and a lot of what drives me is about tackling inequality. That's problems of economic activity and different levels of it, patterns of endemic poor health, patterns of access to good quality places. And actually, these are all the same issue. So, how can we really build better places that will encourage activity? Okay. Part of the problem is that when we are designing places, towns, streets, villages, we look at lots of issues and there are lots of competing requirements. Affordable housing, school places, health facilities, and so there are lots of demands on including things in the design choices. The problem I've seen over the years is that typically when we plan for encouraging an active lifestyle or a more active lifestyle, we tend to underweight that issue. In other words, sometimes it can be regarded as an add-on luxury, a bolt-on, something you include if you've tackled all the other issues. However, all we're doing by underweighting in a decision issues of public activity, take it cycle paths, all we're actually doing is transferring the costs of poor health further downstream for the NHS to deal with the consequences of those choices. Okay. There are answers, and those answers are pretty well known, but that doesn't mean to say they are easy to deliver without us being really committed to this. And it requires a lot of agencies and a lot of people to work together. From my side of it, not just planners and housing officers and highways officers and open space officers, but it's how we work with public health and the providers and encouragers of active lifestyles as well. So, how do we actually then do this thing I've been alluding to of putting in place the ability for people to make easy choices in a right way? In other words, how do you make the right choice easy and the less sound choice slightly more difficult? What we need to be careful of here is avoiding any accusation that we're just imposing more and more red tape on developers, or the fact that we are trying to dictate or be paternalistic to our communities. One of the big criticisms of planning, going right back into the 19th century, was that it was what we call environmental determinism. In other words, we were trying to impose a set of values by how we design places. That, unfortunately, is part of the answer, and that well-designed places, as I keep coming back to, are about making those easy choices, and making them available to everyone, not making it even more difficult than willpower to go for a cycle ride, go for a walk, to get involved in active sport or recreation. Okay, I would say there's some guiding principles that we need to start off looking at, and from my perspective, it's very much focused on activity for everyone. We could focus on bringing online facilities and choices for people who are already active and make it easier for them. In other words, to improve access for people who are already participating in active lifestyles. It's not just about that, even though that is part of it. It's about being able to give everyone opportunities to activity. And part of the problem with that is that for some of us who are trying to pitch the higher levels of activity, somehow these casual levels of activity can be seen as less important. But actually the converse is true, and that it's the people who are inactive are the people we need to be focusing on. So I always would start from how we design what I call walkable communities, making sure that the way that places are designed, the way people understand them, the way they feel about them, the way they feel safe when they are walking, makes it easier to walk between home, school, shops, community facilities, and critically open space. The next stage from that is thinking about how we connect places with walking and cycling routes in terms of making sure those are safe, well lit, overlooked, well maintained, clearly signposted, and again emphasising the importance that we place as society on active use like that. So even though there may be resistance, the walkers and cyclists should be prioritised over other modes of transport in terms of safety considerations. Okay. What we also need to think about is where we put things. And so if we're talking about community facilities, we need to think about putting them close to each other, so when people are making trips, that they will have multi-purpose trips that can be also be done by cycling or walking. Because at the moment, many places are designed that if you need to do several things in one day, it requires several car journeys. Okay. Perhaps the most visible issue we can look at, and it is really important, is a network of truly multifunctional open spaces. Again, not just aimed at semi-professional sports, but aimed at casual sports, open air activities, and the mental well-being that these open spaces give as well. We shouldn't ignore what I would call urban places, and just because a place is urban does not mean to say that it can't be a location for activity. So high quality and well designed streets and town places are as important as those areas of open space I've been talking about. Again, that's about designing in feelings of safety, overlooking, lighting, and the term I use in terms of design is readability. In other words, if you want to walk to the shops, or if you want to walk to the park, it should be immediately obvious and feel safe and short for your trip there, if you're going to walk there. Many people are put off from walking or cycling because their perception of how difficult it will be, or of actually how separate areas of interest are, doesn't match reality, in that people's perceptions tend to be that different places are actually further away. It's about the mental maps people have. And you help address that and you help people think that places are walkable and connectable and cyclable by clear design, obvious things like clear signpostings, but making sure that the area of space used for walking and cycling is clearly delineated and again safe. I can't get away from the issue of what I'd call conventional infrastructure, and that we do need to look at the network of issues like formal play space for children. We do need to look at where investment can give areas of interest that are the natural location for activity to take place. In our county, we have several country parks with great cycling provision there and great walking opportunities. We need to extend the use of those and look for more opportunities to bring online new assets like that. And as well, and perhaps something that you wouldn't have expected me to say when we're talking about active lifestyles, is actually how we design buildings themselves. Buildings themselves are where we spend actually most of our time, and if those particular places of work are designed such that it encourages people to use stairs, to go out at lunchtime, and to feel that they're not bound to one room, that can increase activity. And it's an opportunity that we shouldn't devalue because, as I said, we spend most of our times indoors in this country, particularly in the winter, and looking at the range of activity in buildings can be as important as encouraging people to get the bike and go out and go for a cycle. Okay. So what are we doing in the county council at the moment? Well, from my perspective, I've got the once in a decade opportunity of writing a new local plan. And that gives us the ability to set out our policies, objectives and vision for the medium and long-term development of the county. So we've tried to wire into that a fresh approach to looking at how we tackle health, activity and the use of open space. So what we'll be doing is looking at things like health impact assessment for all major developments. What that will require is for developers to show how they have thought about the issues I've been talking about today in their major schemes, and if they've not done enough, to try and push them and advise them on the way they could do this. We'll also look, wherever possible, to factor in new green infrastructure into development, and that's about new assets as well as enhancing or improving existing assets. And the issue of cycle routes definitely falls into that category where there's a need to think about a fully joined up network and how we help to roll it out by seeking opportunities to use development to generate the funds to provide that next section or an improved section of cycle routes. The other thing we need to think about is that when we are designing places, it's how the local plan policies will look at the entire lifetime of that development. And what we need to do is think about how we can actually secure social benefits and social goods over the lifetime of the development. And that may need us to, for example, enter into long-term agreements over the maintenance of green space, or to make sure that it will be retained as functional and safe in the long term. One of the bits of work that will be perhaps most publicly visible will be in terms of open space. Local communities are rightfully very enthusiastic about protecting well-loved small parks and areas of community space. What I need to understand and gain the residents' enthusiasm is how we focus that on new areas of green space, new areas to promote walking and cycling, because design cannot just impose solutions on people. Solutions have to come from people and be championed by them. So the role of this initiative that you're hearing about today in terms of how we engage the public and their ownership of some of these agendas is really important. And I'd like to think that with the right messages and the right champions for this, that we can get a consensus of views. Okay. So, moving forward, what can all of you do to help me do my part of this agenda to deliver a more active society? Okay. I think it's fair to say there are two main thrusts that I would reach out to you to help me with. First of all, I'd broadly head it under evidence. That's evidence based on places and communities about what they actually need. And that's about looking at what they've got already and looking at deficits, shortfalls, and where information, say, on particular health issues could give us a direction on what type of facilities we need to be thinking about planning for. Equally, it will always be useful to hear from you what works well in terms of initiatives and schemes, and what doesn't work well. My staff can think about what they think will be welcome facilities and answers and solutions to problems, but I need to hear from a range of voices to say what will work best to promote sport and recreation and activity in places. Okay. What will also help me in terms of evidence, and this comes down to the nuts and bolts when I am negotiating with developers to try and sometimes try and appeal to their better nature to help to factor in and design in better schemes. It's the evidence on the benefits of some of the things that we're talking about today. I don't want cycle paths, footpaths, open space to be regarded as the icing on the cake or a luxury that developers should be thinking about providing. They should be a fundamental part of a well-designed place. And to do that, I need to be able to articulate what the benefits are, both benefits to the public, society, and to that developer themselves. Having a proper integrated approach to the access to cycle paths, footpaths and open space should be a great marketing asset for a development. But again, we need the evidence to show what the actual benefits are. And finally, to take this round all the way, I start off by saying that the Garden City movement picked up most of these issues in the late 19th century. It's both depressing that we're still having to argue and champion this, but it's almost reassuring that we are on the right tracks here, and that we are championing a thing that does deserve to be delivered. So what I need is for us to break this cycle of undervaluing and underweighting, as I call it, in public decisions, the provision of thinking about activity and health when we're designing places. At the moment, and this may be even more pronounced once we come out of the COVID crisis, there will be a temptation for either or arguments. Either we can have new jobs, or we can have well-designed places and active places. Either we can have more homes by number, or we can have open space and cycle paths. It shouldn't be an either or. Those patterns of inequality we talked about, while they refer to health, economic success, quality of place, are all the same issue. And by putting the right weighting on the importance of the issue of an active place, I'm sure that we can start to see more and more provision included. This, takes us back to my point about evidence. To be able to negotiate this and to attach the right weight to it requires evidence. And that will enable us to break this cycle. Because at the moment, the health impact, the health problems generated by inactivity don't disappear when you decide not to fund that cycle route, when you decide not to encourage that community scheme. You know, all that happens is that the costs, to be brutally frank, are then passed downstream as adverse health outcomes that the NHS needs to then cure. This salutogenic approach to health I'm talking about says that don't spend the money via the NHS on treating the solution. You know, look at the very start of the issue and avoid the problem manifested in the first place. As you've probably heard several times before during this campaign, if a new drug was on the market which had the same health effects as an active lifestyle, it will be classed as a wonder drug. But from my perspective, for us to be able to not only just give those messages out and encourage activity, we need to give people those easy choices, the right facilities. And this is a joint enterprise, and I hope that you'll all help me deliver my part of the answers. Thank you.